Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024. This research, conducted by Xavier Salord-Torres and colleagues across several veterinary referral centers in the United Kingdom, investigates the significance of elevated bilirubin levels in cats. Specifically, the study explores whether the degree of this elevation, known as hyperbilirubinemia, can provide clues about the underlying disease processes and, crucially, predict the presence of a biliary obstruction, a condition often requiring emergency surgical intervention. As many cat owners and veterinary professionals know, a yellow discoloration of the skin, mucous membranes, and eyes, termed icterus or jaundice, is a visible sign that can be quite alarming. This yellowing occurs due to an accumulation of bilirubin, a yellow pigment in the blood. Total serum bilirubin concentration, or TBIL, is a valuable biochemical marker that can offer insights into various physiological functions and pathological conditions in our feline companions. Veterinarians generally categorize the principal causes of hyperbilirubinemia into three main groups. The first is prehepatic, which typically involves an increased breakdown of red blood cells, leading to an overload of bilirubin production. This is also known as hemolysis. The second category is hepatic, where the issue lies within the liver itself, affecting the hepatocyte's ability to process and excrete bilirubin properly. Finally, there is posthepatic hyperbilirubinemia, which arises from an obstruction in the flow of bile from the liver into the small intestine, specifically the duodenum. However, the situation isn't always straightforward. In cases of widespread inflammation such as sepsis, a severe systemic infection, or feline infectious peritonitis, commonly known as FIP, elevated bilirubin levels can be present without clear evidence of hemolysis, primary liver disease, or a physical blockage of the bile ducts. In these scenarios, the exact cause of the hyperbilirubinemia and its classification become less clear. It's been suggested that in cats with sepsis and FIP, the normal processes of bilirubin metabolism and excretion into the biliary system may be compromised. Interestingly, FIP has also been linked to immune-mediated hemolytic anemia, adding another layer of complexity. Often, even after thorough diagnostic workups, the underlying reason for a cat's hyperbilirubinemia remains elusive. In primary veterinary practices, the immediate availability of and experience with advanced procedures like hepatobiliary surgery and certain diagnostic imaging techniques, particularly abdominal ultrasonography, might be limited. In such settings, the measurement of total serum bilirubin concentration alone could potentially influence critical clinical decisions. Previous veterinary literature has described different causes of clinical jaundice and attempted to categorize them using various total bilirubin concentration ranges. Notably, one prior study suggested that when total bilirubin is very high, exceeding 11.7 milligrams per deciliter or 200 micromoles per liter, conditions like hepatic lipidosis, a fatty liver disease, or posthepatic obstruction are more likely. Posthepatic obstruction, in particular, often signals a surgical emergency. Conversely, when total bilirubin levels are lower, below 5.85 milligrams per deciliter or 100 micromoles per liter, conditions such as hemolysis, FIP, pancreatitis, inflammation of the pancreas, amyloidosis, a protein deposition disorder, and sepsis were considered more probable. While these indicative ranges have been helpful in guiding veterinarians, the authors of the current study point out that, to their knowledge, these cutoff values were primarily based on expert opinion rather than robust, evidence-based research. In human medicine, the degree of hyperbilirubinemia in isolation has been shown to be indicative of obstructive jaundice and can aid in differentiating between benign and malignant causes of bile duct blockage. Although abdominal ultrasonography is recognized as a reliable imaging technique for distinguishing between blockages outside the liver and diseases within the liver, not all general veterinary practices possess the necessary equipment and expertise for a detailed examination using this modality. Therefore, further developing the clinical usefulness of hyperbilirubinemia through a structured severity classification could greatly assist general practitioners in their clinical decision-making, such as determining the urgency of referral, the need for advanced imaging, and the potential requirement for surgery. This is precisely what Salord-Torres and their team set out to investigate. Their goal was to determine if classifying hyperbilirubinemia by its severity could help identify the underlying causes, with a specific focus on conditions leading to biliary obstruction, which, as we've discussed, is often a surgical emergency. They hypothesized that the severity of hyperbilirubinemia might be indicative of the specific pathology causing it, especially when that pathology involves a blockage of the bile flow. To address this hypothesis, the researchers conducted a multicenter retrospective study. They reviewed the medical records of all cats presented with hyperbilirubinemia, defined as a total bilirubin concentration above the upper limit of the laboratory reference range, greater than 0.58 milligrams per deciliter or 10 micromoles per liter, at 3 referral hospitals in the United Kingdom between January 2015 and August 2022. The study was approved by the relevant ethics committee. The data collected included the date of presentation, the cat's signalment, age, breed, sex, and neuter status, the initial clinical signs, the findings from any investigations including abdominal imaging, and the clinical outcome when available. Importantly, cats that did not undergo abdominal imaging were not excluded if the attending veterinarian deemed it unnecessary to reach a diagnosis. If total bilirubin was measured multiple times for a patient, only the first measurement was included in the analysis. Cases with duplicated data or incomplete patient information were excluded. The total serum bilirubin measurements were obtained from 3 different laboratories in the United Kingdom, all utilizing the same upper limit for normal total bilirubin, 0.58 milligrams per deciliter. The severity of hyperbilirubinemia was then categorized based on the following total bilirubin ranges: mild, greater than 0.58 up to 2.92 milligrams per deciliter, or greater than 10 up to 50 micromoles per liter; moderate, greater than 2.92 up to 5.85 milligrams per deciliter, or greater than 50 up to 100 micromoles per liter; severe, greater than 5.85 up to 11.70 milligrams per deciliter, or greater than 100 up to 200 micromoles per liter; and very severe, greater than 11.70 milligrams per deciliter, or greater than 200 micromoles per liter. The researchers established these ranges after reviewing previously described classifications. To determine the underlying causes of hyperbilirubinemia, the researchers retrospectively reviewed each case, taking into account the clinical diagnosis documented by the attending veterinarian and the patient's medical history. In cases where the cause was not clear, the hyperbilirubinemia was classified as having a non-attributable cause, although any diagnostic findings and concurrent health issues were still recorded to identify potential associations. The diagnoses were also further categorized as prehepatic, hepatic, or posthepatic, consistent with established veterinary literature. A separate category was created for all cases with a confirmed biliary obstruction, defined as a blockage of the biliary system that impairs the flow of bile from the liver to the intestinal tract. The diagnosis of biliary obstruction was based on abdominal ultrasonography, which is the accepted imaging method for distinguishing between blockages outside the liver and diseases within the liver tissue itself. The treatment recommendations, including the need for hepatobiliary surgery, were recorded for all cases, including those diagnosed with biliary obstruction on imaging. The researchers chose to record the treatment recommendation rather than the treatment performed to best reflect the clinically necessary course of action for each patient. The final outcome, including death and euthanasia, was also recorded when this information was available. Now let's move on to the fascinating results of the study. A total of 216 cats with hyperbilirubinemia were included in the analysis. Of these, the majority, 64.3%, were male and 35.6% were female. The average age of the cats was 7.9 years with a standard deviation of 4.6 years. Several different breeds were represented, with domestic shorthairs being the most common, followed by domestic longhairs and British shorthairs. The median total serum bilirubin concentration for the entire group of cats was 1.73 milligrams per deciliter, with a wide range from 0.59 to 26.15 milligrams per deciliter. Based on the predefined categories, 68.1% of the cats had mild hyperbilirubinemia, 17.6% had moderate hyperbilirubinemia, 9.7% had severe hyperbilirubinemia, and 4.6% had very severe hyperbilirubinemia. Abdominal imaging was performed in 185 of the 216 cases, with ultrasonography being the most common imaging modality. The most frequently identified underlying causes of hyperbilirubinemia were biliary tree disease, accounting for 25.5% of cases, followed by hepatic parenchymal disease, affecting 10.7%, and FIP, diagnosed in 8.3%. The researchers found a significant difference in the median total bilirubin concentration across the 7 main attributable causes of hyperbilirubinemia. However, in a substantial proportion of cases, 37%, the cause of the hyperbilirubinemia could not be clearly determined or proven. The median total bilirubin concentration in these cases with non-attributable hyperbilirubinemia was 1.2 milligrams per deciliter. Common diagnoses and concurrent health issues observed in these cats with unclear causes included recent trauma, kidney disease, enteropathy, intestinal disease, and cardiac disease. When looking at the broader categories of prehepatic, hepatic, and posthepatic causes, the median total bilirubin concentrations were 1.26 milligrams per deciliter for prehepatic causes, 2.4 milligrams per deciliter for hepatic causes, and 3.92 milligrams per deciliter for posthepatic causes. While there were differences in these median values, the researchers found that using specific bilirubin cutoff points to reliably distinguish between these three categories was not very accurate due to significant overlap among the groups. Now, focusing on the key area of interest, biliary obstruction. Biliary obstruction, diagnosed by abdominal ultrasonography, was present in 17 of the 216 cats, representing 7.9% of the study population. The median bilirubin concentration in cats with biliary obstruction was significantly higher, at 9.69 milligrams per deciliter, compared to those without obstruction, where the median was 1.51 milligrams per deciliter. This difference was statistically highly significant. The researchers found a strong positive correlation between the total bilirubin concentration and the presence of biliary obstruction. Furthermore, as the severity classification of hyperbilirubinemia increased, the odds of a cat having a biliary obstruction also significantly increased. For example, cats with very severe hyperbilirubinemia had dramatically higher odds of having a biliary obstruction compared to those with mild hyperbilirubinemia. All 17 cats diagnosed with biliary obstruction received a recommendation for urgent hepatobiliary surgery from their treating veterinarian. This strong association between increasing hyperbilirubinemia severity and the recommendation for surgical intervention was a notable finding. In fact, the bilirubin concentration alone showed a high ability to discriminate between cats requiring surgical intervention and those who did not. However, of the 17 cats for whom surgery was recommended, only 5 actually underwent the procedure, and the outcomes for these were varied. The remaining 12 cats did not have surgery for various reasons, including client declination and euthanasia. The average age of cats with biliary obstruction was 10.1 years. Interestingly, cats with a mass lesion involving the biliary tree had a similar average age. To further explore the ability of total bilirubin concentration to predict biliary obstruction, the researchers performed receiver operating characteristic curve analysis. This analysis revealed that total serum bilirubin concentration was highly effective in distinguishing cats with biliary obstruction. The optimal total bilirubin cutoff point to differentiate between cats with and without biliary obstruction was determined to be 3.86 milligrams per deciliter or 66 micromoles per liter. At this cutoff, the test had a high sensitivity of 94.1%, meaning it correctly identified most cats with biliary obstruction, and a specificity of 82.4%, indicating it correctly identified a large majority of cats without biliary obstruction. When the researchers applied the previously suggested bilirubin cutoff of 5.85 milligrams per deciliter for identifying biliary obstruction, the sensitivity dropped to 70.6%, although the specificity increased to 90.5%. At an even higher cutoff of 11.7 milligrams per deciliter, the sensitivity for detecting biliary obstruction was only 35.3%, with a very high specificity of 97.5%. Finally, the researchers used multivariable logistic regression modeling to assess the clinical factors associated with biliary obstruction. Several factors, including total bilirubin concentration, age, albumin levels, and activities of certain liver enzymes, showed some association with the presence of biliary obstruction in initial analyses. However, in the final multivariable model, only the logarithm of total bilirubin concentration and age remained as independent predictors of biliary obstruction. This means that even after accounting for other factors, higher total bilirubin levels and older age were both independently associated with an increased likelihood of biliary obstruction. Specifically, for every increase in the logarithm of total bilirubin, the odds of biliary obstruction increased significantly. Furthermore, as age increased, the odds of biliary obstruction also significantly increased. The hospital where the cat was treated did not show a significant association with the presence of biliary obstruction or the total bilirubin levels. This final model demonstrated excellent ability to discriminate between cats with and without biliary obstruction. Now, let's discuss the implications of these findings. In the clinical setting of a cat presenting with hyperbilirubinemia, the measured bilirubin concentration has significant potential to influence how veterinarians approach further investigation and treatment. This study clearly demonstrates that the degree of hyperbilirubinemia is strongly linked to the likelihood of a biliary obstruction. The significantly higher median total bilirubin level in cats with biliary obstruction compared to those without underscores this point. Consequently, cats with severe and very severe hyperbilirubinemia are far more likely to have a biliary obstruction than those with mild to moderate elevations. This information can be invaluable for veterinarians in assessing whether a cat is at higher risk of needing emergency hepatobiliary surgery, and thus warrants referral to a specialist for advanced imaging and potential surgical intervention. While the study also explored whether total bilirubin levels could differentiate between the various underlying causes of hyperbilirubinemia, the most compelling finding was the predictive ability for biliary obstruction. In human medicine, as mentioned earlier, bilirubin concentrations are an important tool in distinguishing different causes of obstructive jaundice. However, this study provides novel evidence for a similar utility in feline medicine. The study highlights the limitations of relying solely on previously suggested higher bilirubin cutoff values for identifying biliary obstruction. When the commonly cited cutoff of 5.85 mg per deciliter was applied to this study's data, a significant proportion of cats with biliary obstruction would have been missed. The even higher cutoff of 11.7 mg per deciliter showed an even lower sensitivity for detecting biliary obstruction. While these higher cutoffs might be good at identifying cats who likely do not need surgery, they carry a substantial risk of missing surgical candidates, potentially delaying critical intervention. Therefore, the researchers proposed lowering the bilirubin cutoff used to select cats for whom abdominal imaging is crucial to identify those needing hepatobiliary surgery, from 5.85 mg per deciliter to 3.86 mg per deciliter. Although they acknowledge that this lower cutoff might lead to some cats being incorrectly considered surgical candidates who ultimately require medical management, they argue that the potentially life-threatening nature of biliary obstruction necessitates a more cautious approach, prioritizing referral for abdominal imaging. This finding should assist veterinarians in their decision-making when faced with a cat with hyperbilirubinemia, in conjunction with a thorough clinical assessment and consideration of other factors like the cat's history and physical examination findings. Identifying surgical candidates is paramount for improving patient outcomes. Recent studies on cats with hepatobiliary disease have indicated that surgical treatment for biliary obstruction can lead to longer survival times and a better prognosis compared to non-surgical hepatobiliary diseases. While older studies suggested higher risks associated with biliary tract surgery in cats, more recent evidence points towards improved outcomes. Interestingly, in this study, a significant number of cats for whom surgery was recommended did not undergo the procedure, highlighting potential reluctance among owners or veterinarians, possibly due to historical perceptions of poor outcomes. The researchers emphasized the need for further studies to better evaluate the risks and benefits associated with hepatobiliary surgery in cats. Beyond bilirubin concentrations, the multivariable analysis revealed a significant association between increasing age and the odds of biliary obstruction. This suggests that conditions leading to biliary obstruction may be more prevalent in older cats, while inflammatory conditions like FIP and certain types of cholangitis might be more common in younger animals. This age-related finding mirrors observations in human medicine, where obstructive jaundice is a common reason for abdominal surgery in older individuals, and a significant proportion of these cases are due to malignant tumors of the hepatobiliary system. Even in cases of non-cancerous biliary obstruction in humans, timely surgical intervention is generally recommended. In this feline study, a proportion of cats with biliary disease had identifiable masses on imaging, and biliary obstruction was confirmed in all of them, although the malignancy status of these masses could not be determined. The average age of these cats with biliary masses was around 10 years. The authors acknowledged several limitations to their study, primarily stemming from its retrospective design. While medical records were carefully reviewed and diagnoses thoughtfully assigned, a considerable number of cases lacked a definitive diagnosis for various reasons. Similarly, the presence or absence of biliary obstruction was determined based on the review of clinical and imaging records, but a standardized definition for inclusion in the biliary obstruction group was not pre-established. It's also possible that biliary obstructions were missed in cats that did not undergo abdominal imaging, although the majority did. Furthermore, in the cases where the cause of hyperbilirubinemia remained uncertain, further investigations might have revealed underlying conditions. For example, jaundice can occur in trauma patients due to various factors, and subtle hepatobiliary changes might have been overlooked in some cases. Additionally, the classification of hyperbilirubinemia by its origin, prehepatic, hepatic, posthepatic, involved some degree of author interpretation, particularly for systemic diseases or conditions affecting both the liver and biliary tree. However, the authors believe that different classification principles would likely not have altered the main findings. Another limitation is that the study population consisted of cats presented to referral centers, which might not entirely represent the population of cats with hyperbilirubinemia seen in primary care practices. However, the researchers believe that the suggested bilirubin cutoff of 3.86 mg per deciliter is still valuable for assisting general practitioners in their clinical decision-making regarding the need for emergency referral for advanced imaging and potential surgery. They highlight the need for future research in general practice populations to further validate these findings. Finally, While all methods used to measure total bilirubin were validated for feline serum, the researchers acknowledged the possibility of artificially increased bilirubin levels due to hemolysis or lipemia, particularly in cases of very mild hyperbilirubinemia. The retrospective nature of the study prevented a prospective evaluation of serum sample quality. In conclusion, this study provides strong evidence that the severity of hyperbilirubinemia in cats is a valuable indicator for distinguishing between those with and without biliary obstruction, a condition that often requires emergency hepatobiliary surgery. The researchers proposed lowering the previously suggested bilirubin cutoff for prioritizing abdominal imaging in these cases from 5.85 mg per deciliter to 3.86 mg per deciliter to avoid missing or delaying the diagnosis of biliary obstruction. Furthermore, the study highlights that the likelihood of biliary obstruction increases with age, making the combination of age and hyperbilirubinemia severity a useful consideration when assessing the risk of this condition. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.